Hello, my name is Dawi Gobena, and my injury prevention plan is on falls. Some background on falls. So, the epidemiology and impact of falls in the elderly. Falls are a critical public health issue, especially prevalent among those over the age of 65. Statistically, over a quarter of this demographic fall each year, but less than 40% report these incidents to healthcare professionals. The aftermath of falls is concerning, with one in every five causing serious injuries like fractures or head traumas. Annually, around 3 million Americans receive emergency treatment for fall related injuries, with a significant number requiring hospitalization. So, with some personal anecdotal evidence, I'm an EMT and I often see elderly patients who fall. And I would say at least once or twice a day, we get a call to a patient who has fallen, and 9 times out of 10, they are elderly. So, this just highlights the impact that it has on this population. The economic burden and healthcare burden. Financial implications are substantial, with healthcare costs for falls exceeding 50 billion, primarily covered by Medicare and Medicaid due to these patients being elderly and sometimes disabled. These figures underscore the necessity for effective prevention and management strategies in this high risk group. Psychological and social implications. So, beyond physical harm, falls cause a lot of mental health and social life issues. The fear of falling often leads to individuals having decreased activity levels, or basically not going out, interacting with individuals, doing things through the fear that they may hurt themselves, which then causes poor mental health since we are social beings. Risk factors and prevention. There are myriad of factors that contribute to the increased risk of falls. These include, but are not limited to, lower body weakness, vitamin D deficiency, balance and walking difficulties, certain medications like tranquilizers, sedatives, antidepressants, visual problems, and environmental hazards such as cluttered living spaces. Additionally, those who do not walk as often, those who do not do certain activities as often, are more likely to fall. And this is just a negative feedback loop due to elderly folks feeling like they don't want to fall, so they may not exercise, and them not exercising then causing them to have more weakness, then causing them to fall more often. Intervention and management. Targeted interventions for elderly focus on minimizing these risk factors through various means, including medication enhancement, exercise, regular visual examinations, and home safety modifications. Educational initiatives for elderly and caregivers about risk and prevention strategies are vital. To continue on to our literature review, I reviewed two different papers, one from Lee et al. Titled Preventing Falls in Geriatric Population. This study emphasized the prevalence of severity of falls, noting that 1 in 3 in elderly community settings experience falls annually, often leading to severe injuries. Additionally, they discussed the economic burden with over $19 billion being related to fall related costs in the year 2000, a figure that's expected to rise and which has a significant point that is made as a psychological impact of the fear of falling, which decrease activity and increase frailty. Um, the second paper I went over is insights from Gillespie et al. In the intervention, the title was Interventions for Preventing Falls in Elderly. Gillespie reviewed various interventions affirming that 30% of elders living uh, over the age of 65 fall each year. Their analysis points to effective multifactorial, multidisciplinary interventions, including muscle strengthening, balance retraining, home hazard evaluations, and medication adjustments. These studies underscore the importance of individualized interventions such as Tai Chi, which aligns to broader themes of physical activity and critical prevention measure. Convergence of findings and best practices. So both of these researchers concurred that there is a need for multifactorial assessments and interventions, and that this can reduce rates of falls up to 40% in community dwelling adults. Literature collectively shows the importance of addressing not only physical but psychological factors, such as promoting exercise and safe practices with elderly individuals so they do not fall, but also improve their balance and coordination. These studies highlight also the importance of healthcare workers and providing comprehensive fall prevention strategies, patient education, and then regular health assessments. So my proposed intervention has 7 steps, drawing from both articles from Gillespie, Lee, as well as CDC findings. My intervention employs a multidisciplinary, multifactorial strategy tailored to the elderly population. There's multiple components of my intervention. First would be a risk assessment on the patient and personalized plan. This includes a comprehensive assessment of the individual factors, including physical health, medication review, and environmental hazards in living space. The second step would to implement physical therapy and exercise programs. This incorporates strength training, balance, and training exercises such as yoga, tai chi, tailored to each individual's capabilities and needs. Third would be a medication management. I've had multiple patients in the past who have started a new medication that may have caused drowsiness or weakness, and they were not aware of this, thus causing them to fall and needing us emergency medical services to come out and assist them and take them to the hospital. So addressing this, these healthcare professionals addressing the medications they're prescribing and the risk that comes with this will be much more impactful. The fourth is home safety evaluations. Additionally, I often see patients who fall over a box or their carpet rolled up and they tripped. And these are things that, if a home assessment was conducted, could mitigate these factors and falls. Things like poor lighting, cluttered hallways, slippery surface also cause falls. Fifth would be vision and foot care. This would include proper checkups with a podiatrist and as well as vision checkups to ensure that their vision is intact and that they can see and are not tripping over things that they did not see. Educational workshops and awareness would be my sixth step, which include educating the elderly. So a primary care physician can educate their patients on, hey, if you have this in your home, make sure you are aware. Make sure you're looking at how you can fix your home to be as safe as possible, as well as urge the importance of physical activity. Seventh would be community engagement and support programs. I often have to take patients to the hospital due to their falls. And if there was a social worker who came and basically trying to figure out why did this person fall, what were the risk, and how did this occur, this can may prevent future falls from happening because they can tell them what to do and what to change so they can be safer. Additionally, technology integration would be important. I know I've been with many patients who have called us using a lifeline necklace where they can press a button that calls emergency services, and that's extremely important because it allows us to respond in adequate time so they can get help. I had one patient who fell and was on the ground for over 24 hours because she could not get up and she was elderly and she lived alone. She then suffered a hip fracture, and due to her age, she was unstable enough to get surgery to repair this. And ultimately, she ended up on hospice care because of this fall. Whereas if we were maybe able to respond earlier, we could have prevented certain things from happening. Overall, the goals and expected outcomes from this is to significantly reduce the incidence of falls among elderly patients, improve their quality of life, and decrease the associated healthcare costs. Expected outcomes are improved physical health, better balance, awareness of fall risk, safer living environments, and overall well-being of the elderly population. So this is my presentation on injury prevention falls, my injury prevention plan on falls. Thank you so much.